Contract provider. My name is Carrie Bambro. I'm the director of the Division of Continuous Quality and Improvement, and I am here covering for Amanda Slater, who wasn't able to make it. So I'll be hosting the meeting, and we'll be working through all of our announcements and questions. So for those of you that are new, this meeting is an opportunity for us to share updates that are happening within the department, and it's also time to for you all to ask questions and for us to answer those. So we encourage you to use the chat function if you have questions that you want to ask during this meeting. Just a couple of housekeeping reminders. Closed captions are available for those who would like them. You can click on the live transcript in the menu bar at the bottom of your Zoom window to enable the closed captioning. This meeting will also be recorded. So for those of you who could not attend live, and we'll send out that recording after the meeting. It will be uploaded to YouTube, and once the recording has been rendered, it'll be uploaded to YouTube and shared with everyone. Again, just anytime during the meeting, please enter any questions into the Zoom chat, and we'll do our best to answer them all during the meeting. And in addition, questions can be submitted at any time prior to this meeting. We'll drop the email in the chat where you can submit those questions ahead of time if you have them. All right, well, we'll just go ahead and get started on our updates and announcements. So I just have one from the department-wide. So every year we go through our strategic plan and we update any changes to that. That has happened, and we did make just a few small changes to our strategic plan for the department this year, and that can be found at our website, and we'll also drop that in the chat, so if any of you want to have access to that, you can look at it. And our scorecard that we keep all of our measures on will also be updated in the next couple of days. So we encourage you all to look at that, and if you have interest in where our strategic goals are for the next year. And I'm just going to go ahead, Spencer, if you're okay, I'm going to skip to me and then we'll come back to you. So I'll go ahead and do our division. Thanks. Our division announcement. So for the continuous quality and improvement, under the Office of Service Review, we are going to start doing quarterly TA calls. These TA calls, so technical assistance, these calls will be tailored toward new providers, but anyone is welcome to attend. We will have a way to submit questions ahead of time so appropriate representatives can be there if there's other questions that our partner OUs can help answer. It really is a time for us to just be able to answer questions, be a support, and try to help get to some of you that if you have a hard time getting through a set time that we can answer questions on contracts, procurements, anything to do with DHHS. So we'll be getting out the link for that first meeting, which will be held Tuesday, September 2nd from 1 to 2. It will be done virtually via Google Meet. So that will be sent out in the email, as well as the link to submit any questions prior to the meeting. But the meeting will also, you'll have time during the meeting to ask any questions that you have. So we're excited to offer that resource to our new providers, or really anyone who just have questions that you want to ask. Two other things that the Office of Service Review are working through. We are working with the Office of Licensing on a couple of things that we received feedback on, and we are trying to be responsive to that feedback. The first one is to align requirements between what the Office of Service Review oversees and what the Office of Licensing oversees as it comes to our contracted providers. We are working together to look at those, remove duplications, and align any requirements. So hopefully you're not seeing us all looking at the same things. We both do have a separate look that we are required to have over our contracted providers, but we want to make sure that we are doing that in alignment and not duplicating those efforts. So that is happening right now. We are also going through all of the training requirements. This was another big piece of feedback that we've received. So we're looking at the training requirements between what Office of Licensing requires for specific licensures, as well as what the different contracts require. And again, with the same idea to align those, remove duplications, and just make sure that the training requirements that we are looking at and asking for really make sense. We will be putting together a small group to review the training requirements, and would love to have a few of our partner agencies involved. So we'll be sending out some communication for that if you have anyone that would be interested in attending that, to just help guide some of that conversation. So that is all the updates from our division. So Spencer, I'm going to pass it back up to you.
Okay, thanks, Carrie. If you were with us last quarter, we talked about some amendments we were doing to terms and conditions to change insurance requirements. and also to add a few new terms. And if you weren't here, I'll give you a very brief overview of the changes. We're removing the additional insured endorsement requirement. We're removing the requirement that insurance must be written on an occurrence form. So we will allow claims made insurance. We're removing the AM Best insurance requirement. We're also adding several new terms, a term for artificial intelligence, a term related to HB 261 and non-discrimination, a term for remediation, and a term that requires DHHS approval prior to publicizing the contract. So we have sent many amendments out. We're still in the process of completing these, so there are more to come. If you have any questions about the amendments, you're welcome to reach out to my office. That's all I have. Thank you.
Hey, thanks, Spencer. All right, next we have DCFS, and Kyla, I believe you're taking the lead today.
All right, and I just have exciting updates for those of you that are waiting on the family-based amendment for the professional parent part of IRTS, as well as the small group home. Both of those are now live and available on the DHHS procurement website. And I can get links to those if you guys want to send that out as well. And then I am available if you have any questions about those. Yes, you may be receiving old language contracts because they are extending them. We're doing an amendment till the end of September to give time for the new applications and all the code changes to end on the back end. So providers should be expecting actually an amendment of their existing IRTS contract to come out for signature this week. And that will have that active through the end of August.
All right, thanks, Kyla. I'm going to jump to Division of Services for People with Disabilities. Marcy.
Yeah, we just wanted to make sure everyone knows that the DSPD's, the new contract for support coordination external went live on July 1st and is replacing the previous. So the new contract is 91258 and it's replacing 90828. So the new scope of work can be found on the purchasing website, which we'll put in the chat. That was it for us. Thanks.
Hey, thanks, Marcy. Next, I will jump to Division of Licensing and Background Checks, which I believe, Daphne, you are here for them today.
Yes, I am. Thank you. Hello, everyone. So there is no updates for any additional updates other than those that Carrie has covered with the Office of Licensing. For the Office of Background Processing, again, we have kind of modified our DAX process. We have been doing training sessions. That training is available on the website and in DAX. And if you have not completed the form, we will provide the form for you to fill out to complete for your program as well. And that is our only updates. But so far that training those updates started this week and have gone well. So thank you.
Great, thanks, Daphne. And we've got going pretty quick today. We don't have a ton of updates. We do have Chanel Wong here, who's with the Office of Substance Use and Mental Health. If you have questions, but Chanel, there's no updates from you all today. Is that correct? Juvenile Justice and Youth Services, they were not able to attend today, but if you have any questions for them, we're happy to take them and get it back to them, and we'll respond with any that are for them, as well as for Medicaid long-term services and supports. Joseph wasn't able to make it either, but we will answer any questions that we can, or we'll get the questions to them and a response back out to everyone. So those are all of our updates from the department today, but we would love to answer any questions that you have. So as a reminder, you can enter those questions into the chat or the question and answer section at the bottom of Zoom, and we'll start working through those now. And again, you can submit questions at any time through the email that was provided earlier, and we'll get that in the chat. Just as a reminder, submitting questions in advance does help us prepare to make sure that we can answer your questions. So we encourage it. If you have some ahead of time, we'd love to see those. And then at this point, we're going to go ahead and open up to question and answer if you have any for today for our division representatives that are here. Here's one to you, and I don't remember if you've answered this one, but it says, is the new family-based service contract effective 7/3/2025? And does that mean the rates are backdated to 7/3/2025?
I'm sorry, was that for me?
It was for Kyla, sorry.
Sorry, and you're asking about the backdating of payments, so that the amendment should process this week or in the next week, so there shouldn't be a gap in payment. Like it should, your current IRTS budgets will pay through the end of August of 31. So even though I see that it went live on July 3rd, your amendment to IRTS will be what we pay through the end of August.
Great, thanks, Kyla. All right, there is a question, Spencer, this may be for you. I recently received a request to sign the contract and the old language was still in there. I didn't sign it and instead requested to receive an updated contract. I have not heard back. What is my responsibility here?
Okay, I am aware of several contracts that the contract analyst accidentally included the old language on. I would encourage you to reach out to the contract analyst who sent the contract and just make sure that it's on their radar. I know that there are a number in the works right now that are still outstanding, so it's probably in the queue, just waiting to be corrected. But if there's any question at all, please reach out to the contract analyst who sent the contract amendment to begin with.
Perfect, thanks, Spencer. Marcy, there are a couple for you. If you want to try to tackle those, I'll go ahead and read it. I have a question about the ISO process, which I'm assuming is for DSPD. If a person is coming off the wait list, I know that they go through the ISO process. What about people who are with a provider and want to switch providers? Are they going through the ISO process? It feels like there are a lot of people being assigned to providers of a support coordinator's choice or recommendation without giving all providers a chance to write for the person. The smaller agencies are struggling to get clients.
So unless a person has a particular provider that they are requesting to go to, all of them should go through the ISO process. We're working on some improvements to that process, but that's how they should be. The support coordinators are sending out ISOs to look at the options for providers. So unless there's just a choice that they or their guardian just say, no, this is the provider we want, it all should go through that process.
Okay, perfect. And I have another one for you. Do you know when there will be an updated contract scope of work for 91172?
Know that we're looking to do some amendments on October 1st. So that should be the next one where we have some items come out.
You and one more about the 91172 contract that Marcy or Spencer, maybe one of you can answer. It says, what is the contract requirement for the non-auto liability insurance for providers under the 91172 contract?
Might be a Spencer question, because if it's not, I'll have to get the answer for that.
Yeah, we might need to clarify that. I will say the auto insurance requirement is conditional. It states if the contractor supports clients or goods, the contractor shall maintain commercial automobile liability insurance that covers property damage, personal injury protection, and liability for the vehicles used by the contractor. And the policy must provide for a combined single limit or the equivalent of not less than $1 million per occurrence. If the contractor subcontracts for all transportation, the contractor may satisfy this requirement by submitting proof that its subcontractor meets this requirement. And then as a follow-up on that, our subcontractor insurance requirement just states that subcontractors must maintain reasonable levels of insurance. If that didn't answer the question, feel free to reach out to my office with more specifics and we can dig into the details.
Thanks, Spencer. And I'd like to welcome Joseph. He was able to make it. And we do have a couple of questions regarding the Medicaid waivers after the big, beautiful bill that has passed. So Joseph's going to try to take a crack at a couple of them. So I will read them and then Joseph, I'll turn it over to you. What can providers who contract with the state to provide services within Medicaid waivers expect from the big, beautiful bill that just passed? What is the state expecting and preparing for? Along with that, are there concerns that should providers be concerned with the new bill as it relates to Medicaid? And what are the states implementing? What do we understand as the implications of Medicaid and the Medicaid waivers based on this bill?
Thanks, Gary. And great questions. Obviously, probably a lot of attention paid to the events last week at Congress. But honestly, as far as what we've been able to pull out of the bill thus far, the implications to programs serving individuals with disabilities and aged populations are rather limited. We will be looking at trying to unpack something for providers, possibly looking at the next quarterly to give you a more comprehensive update. I think a couple of pieces to key in on are some changes that they are making to retroactive eligibility. So we do have individuals from time to time who may lose Medicaid eligibility. It will be more important now than ever to kind of pay attention to those timeframes, as we will only be allowed to go back 60 days from the date of application to look at a retro period when it is currently 90 days. For expansion populations, for those that are part of either the adult Medicaid expansion or targeted adult Medicaid expansion, neither of those kind of fall within DSPD's group, where those are folks who are on disability programs. Those will have even shorter windows for their retro coverage. So there will certainly be individuals affected, perhaps more on an extended family situation, perhaps parents that might need to pay more attention to their review cycles, or perhaps if other family members are part of those coverage groups. But as far as the traditional DSPD providers, very few changes actually affect what we do in the long-term care programs. Again, we will look to provide a more comprehensive look at everything that does affect Medicaid participants. But with all of the uncertainty out there, I know why this is probably front of mind for a lot of individuals. Please feel free to reach out to us to throw questions at us if you have found provisions of the bill, or if there have been rumors that have been churning that you would like us to weigh in on. But again, for home and community-based services programs in particular, there are very few provisions that are directly affecting programs. And also to keep in mind that many of the provisions in the BBB will not go into effect for many years. So even for the work requirements portions that have been discussed, I believe an implementation date of 2028 is for those requirements. So we are still a ways out from enacting many of these changes. Honestly, on the HCBS side, there was actually a provision passed which gives states greater flexibility in how we are covering waiver populations. We can now, or come 2028, can propose a level of care which is less than the facility-based equivalent. So again, still unpacking exactly what those mean, how they will affect our programs, and we will look to provide a more comprehensive update. But as far as what you can expect, as far as changes tomorrow, there are simply not any at this time. So hopefully that provides at least a little bit of help right now.
Thank you so much, Joseph. And I think you mentioned this, but as you said, we will update and send communication as soon as we have the information we can share ongoing. Okay, one more actually, Joseph, that just came in, and if you want to tackle this one, does this bill affect federal match for waivers, or will it, as far as you know at this point?
Yeah, and I think a few people kind of caught the some of the initial iterations of the bill, perhaps, that suggested if the state is or has programs which provide care to undocumented individuals, that there may be a loss of federal matching funds associated with that. Some of those provisions were stricken in the final passage of the bill, where we're not anticipating anything changing on our federal match rate of significance at this time. Utah's economy, as a result of it performing better, particularly in the last 5 to 10 years, we have seen a reduction in our match rate with CMS, but that is more of just the economic factors that kind of create that formula for what we call the FMAP, the federal participation that we receive. We're down to now about 64 cents on the dollar, where so every dollar of Medicaid expenditure, approximately 64 cents is federal, and the remainder is state. So we are seeing that kind of pivot where we used to have roughly a 70-30 match, but that is a result of economic indicators and has nothing to do necessarily with the BBB.
Thank you so much, Joseph. All right, Daphne, switching over to you for a couple of questions. The first one, for DAX updates, what category would we be in as a provider under RPS, which I believe is a respite code for DSPD?
Great, thank you. The best category for this, for the respite services, is going to be under professional parent. And if you have any other questions while you're filling out the form, or have any other specific scenarios, you can either put them in the notes at the bottom of the form, and someone from our team will reach out to you, or you can also email dhsdax@utah.gov with those specific questions to help.
Thank you. And one more, how do we acknowledge the DAX training that is now available on your website?
You do not need to, there's no form to specifically acknowledge it, but I'm going to include a link directly to the training video here so that you can easily access that and find that.
Perfect, thank you. Spencer, we've had a request if you could drop your, oh, actually, I think looks like Josie might drop your email address in the chat. So we'll get that added in there. So if anyone needs Spencer's contact information. And then another question about subcontracting. Spencer, this may be best for you. In the past, the IDRC contract from DSPD outlined which services providers were allowed to subcontract. That language no longer exists. Is there a limit to the type of services that can be subcontracted?
Yeah, that's probably best asked to DSPD. I will say the contract states that the contractor shall not subcontract without the prior written consent of DHHS. And so if a request to subcontract came in, we would turn to DSPD to look into that request.
Perfect. Thank you, Spencer. Marcy, anything you wanted to add there?
Currently, the only places that we have subcontracting is for host homes. The host home can subcontract with the provider rather than be a regular employee. And then recently we have granted subcontracting ability with massage therapy. But those are the only ones that I'm aware of that we do any subcontracting with.
Perfect. Thank you. All right. Those are the end of the oh, actually one just came in. And Daphne, this one may be for you. Do administration workers that do not have access to DSPD clients require a background check?
Let me make sure. Off mute. Okay, I am. Sorry. Did not know if I was off mute or not. What is required by statute is anyone with direct access. Direct access means like even physical or personal touch or hearing, or any access to client records as well. So that could be personal identifying information, financial information, etc. So anyone with any type of that direct access is required to complete a background check.
Thanks, Stephanie.
And Carrie, just one thing about that question about RPS, it would be best for them to talk about exactly which kind of respite code they are using, and to know if there is a licensure requirement. So not all respite, respite is generally a service that's done in people's homes. And so it doesn't require that license. So they would need to check on their particular code that they're using. I just didn't want people applying for professional parent if they're only doing respite in people's homes, because that doesn't require that professional parent license. But I'm not sure we know exactly which code they're talking about, so it would be good to get clarification on that.
Thanks for that clarification, Mercy. Okay, we've had one last question come in, and I'm not sure if we're going to have the answer. I'm going to go ahead and ask it and see if some of our panelists might know. Otherwise, we can always respond after. In the past legislative cycle, 26B2110 was enacted to allow accredited adult substance use and mental health providers to become a deemed site and opt out of licensing renewal inspections from DHHS. How do we go about becoming a deemed site to opt out of renewal inspections?
So speaking for the Division of Licensing and Background Checks, that is one we're going to have to take and get back with you and circle back with you on. Okay, Erin, we'll get that.
Thank you so much, Stephanie. All right, we still have a little bit of time. Are there any additional questions that you all have? We'll give it a few more minutes to see if any come up. And we just want to say again, we really appreciate you all taking time to be with us today. So we can answer your questions, just a time to connect and for us to give feedback. Daphne, it looks like Aaron is just asking for an email address to where he can circle back with any questions.
Sorry, that was me, and that should have just gone to Aaron.
Sorry, Daphne, you're right. It was you.
So Aaron, if you can reply to my message with your email address so I can circle back with you.
Okay, I'm not seeing any other additional questions come in. So again, we just want to say thank you. We appreciate your partnership in ensuring that all Utahns have an opportunity to live safe and healthy lives. We also want to make sure that this meeting is useful for all of you and make sure that we're covering items that are important to you. So in the follow-up email, there will be a link to a survey that we encourage you all to fill out to make sure that we are addressing the needs of everyone joining today's. But please feel free to submit that feedback at any time. We look forward to sending out the email from information about the next DHHS provider meeting that should also have when the recording will be available. And we look forward to seeing you all next month, which will be October 14th at the same time, noon, same platform. And again, just a reminder, if you have questions ahead of time, you can submit them to the email that we just dropped in the chat. And I believe that is all. So thank you again. We appreciate your time, and we will see you all in October.